Welcome to City Vibes Metro. I'm your host, Christina Andrianopoulos, and I am pleased to debut the newest lifestyle program in Worcester County on Charter TV3. In this week's show, on our health and fitness segment, we will be speaking to renowned cosmetic surgeon, Dr. Cynthia Poulos, who will talk about that taboo subject, plastic surgery, or how to look youthful and refreshed without surgery. On our style and fashion segment, we will be talking to the famous Karen Shea, owner of Karen Shea Modeling Agency, and she will talk about the hottest fashion straight off the runways of New York. And in our Vibe segment, I have the great pleasure to have as our guest Chris Crowley, who joins us to discuss socializing and going out even in a down economy. So don't go away. We'll take a short break and be right back. I'm Christina Andrianopoulos. Join me on City Vibes Metro, a new and exciting program on Charter TV3. A lifestyle show, sort of a blend between The View and Sex and the City, with style, featuring great in-the-know guests talking about health and fitness, style and fashion, and of course socializing and dining out. Diva information that will make you the star of your next party. City Vibes Metro, everything you wanted to know, topics but were afraid to ask. Thursdays, 9:30 p.m. here on Charter TV3, starring me. Welcome back to City Vibes Metro, and today in our health and fitness segment we have the renowned Dr. Cynthia Poulos. Welcome, Cynthia. How are you?
I'm doing well, thank you.
Great. Well, you know, I said it in my intro that sometimes this subject is taboo, and I wanted to discuss that. But first of all, tell us about you and your practice and how long you've been doing this.
My main practice is located in Northborough, where we have a med spa as well as my surgical practice. I operate out of Milford Hospital and see patients there, and I operate out of Marlborough Hospital as well as operating in the office.
How many years have you been a plastic surgeon?
After all my training, I've been in my own practice going on 15 years at this point.
Wow, so you've been refreshing, getting people to look more refreshed and youthful for 15 years.
Oh yeah, and you know what, there's so much that's been evolving over the past, say, 5 to 10 years that has really revolutionized a lot of how we practice.
That would be a whole other show for the whole about that. But what I wanted to talk about today is maybe some of the non-invasive, the non-surgical treatments to make you look youthful and refreshed. Do you mind going over that with us so our guests know about those?
Sure. That's a lot of how we start with a lot of our patients or our clientele. I mean, basically, people are scared of surgery, so they want to look better, they want to look more youthful, more rejuvenated, and they're not yet ready to make a commitment to have a surgical or a more involved procedure. So they'll come in just inquiring as to what can I do to look more refreshed. I want something that's just a little minimal. I don't want everybody to know that I've had something done, but I do want to look better. We start out by talking about skin care, making sure that somebody's using sunblock to protect their skin, address any issues that might be addressed at home with a good product. But above and beyond that, we start talking about the filler types of treatments, the laser treatments, Botox, those things that you can come in, have done in a quick type of office setting, and then go about your business with minimal, if any, downtime.
Okay, let's just take me. I'll come in, and you're going to give me a consultation, and you've gone over all of my skin care, because I take very good care of my skin. I use sunblock. Now, I've got a show, so I want to look a little bit more refreshed. You know, maybe shave 5 years off of my looks, because I exercise, so I sort of want to look.
Okay.
Yeah, so
well, you look at the areas of the face that concern somebody. Botox can be used in a lot of different areas. It is used primarily and indicated for the frown lines, as we call them, the 11s, you know, the 2 lines that go up and down there. But there are a lot of other areas that you can use it for. If you have the lines that go across the forehead, the smile lines, sometimes people like having those lines of expression, but a lot of times if they become very obvious, it's something that you want to address. There are other areas where we use them, the lipstick lines. We'll use a little bit of Botox to be able to minimize some of that movement and that crinkling. It's amazing what a difference it could make. I mean, people are worried, oh my gosh, I'm going to look fake, I'm going to have that my face can't move sort of look. And that's not how it works. I mean, you still have a natural, normal expression, but you're minimizing the negative expressions. Typical of somebody having Botox, particularly for the frown area, is that people say, oh, why do I look mad? Or you know, even some women will say, their kids will say, Mom, why you look so angry? And they'll say, I'm not angry, I'm a happy person. And essentially you can change somebody's expression to look rested, more happy in a certain sense. So, and it doesn't have to be fake at all. It really is, it's a great tool. It's a great medication, essentially.
That's great. And then there are other treatments as well, the fillers you were talking about. So go over
and
some of them.
we'll frequently use those in combination. A lot of people think, oh, I have a line, you can use Botox there. Well, that's not necessarily, you know, a Botox indication. The furrows that one gets from the nose down to the corners of the mouth, called the nasolabials or the nasolabial folds. That's an early tip-off to aging changes. So if you can fill in that area, plump that area up, you reverse some of the aging changes that people will complain about. In addition to making the frown lines go away, a lot of times the corners of the mouth will turn down. You can put Radiesse, Restylane, a number of the different fillers in those areas to basically actually turn the corners of the mouth up in a natural way. The fillers that we have are temporary, but they last for a number of months. You can have a filler that lasts even up to a year. They're very well tolerated. The incidence of negative reactions is very low. But you know, those are the kinds of things that we talk about. We absolutely give the full information, what's involved. Another big area that we're doing fillers are around the eyes. Many people come in and say, well, do I need surgery? I don't want surgery yet. Am I ready? And you can fill in where some of the creases will occur around the eyes, and you take somebody who looks tired and has shadows, and all of a sudden, you know, they don't look tired anymore. There is another filler that we have called Artifil. That's right now the only permanent filler that we have, but usually we start out with the temporary ones because a lot of people want to know, what am I going to look like? So rather than going right away to something permanent, we'll use the temporary fillers, albeit, you know, they do last for a long time. And not necessarily an age-related change, but is sometimes one of the things that we do very frequently is making the lips look fuller. Not in a Goldie Hawn, First Wives Club kind of way. You know, it's natural. You know, I think that's really my philosophy and the philosophy of the people who work in my office. We want you to look better. We don't want you to look fake. And I think that's what so many women in particular are afraid of. You know, they see examples of exaggerated extreme things, and I like to describe it that we don't do the Hollywood look. We just make you a better version of yourself.
You do the Worcester County look.
Which is a good thing.
Yeah,
That's
it is a good thing.
It definitely is.
Yeah, I wanted to talk about these topics because I know I have several friends, and we're aging nicely, and you know, and there are alternatives that you can look into, and I think in this type of show we should talk about it and bring specialists like you in. Well, to know more about it, and maybe tell us, well, how long do some of these treatments last?
Well, Botox will last anywhere from 3 to 6 months. The average really is about 3 to 4 months. You know, we call this kind of preventive maintenance. When you start on these treatments, you may start at a younger age. We have people that come in their 30s to have treatments done. You tend to put off the big things longer when you start at a younger age because you're really doing maintenance. A lot of these fillers, your body will respond by developing new collagen, and collagen helps to firm the skin. Laser treatments that we do are also very beneficial. We'll have Thermage, which is not non-laser but still an in-office skin treatment. Skin Tight will do fractional resurfacing. Things that enable the body to build up more collagen and firming in the skin are going to put off the age-related changes that much longer. You know, so if you once a year, once every couple of years have a laser treatment where really the healing time is not that long, and some of these laser treatments, basically you look like you've had a little bit of a sunburn for a few days. It's really no worse than that. And you're doing maintenance, and we have many people that will come back with regularity, and we encourage that just because you can look refreshed for a lot longer by doing those things. So it's a combination of laser, skincare, fillers.
You know what, Cynthia, I wanted everybody to know how they can find you, so tell us where your office is or your website or something. So, Dr. Cynthia Poulos.
We're at 17 South Street in Northborough. My website is www.drpoulos.com or www.classicmedspa.com. If you go to the website, you will see a list of all the services that we provide, video, as well as descriptions of surgical and non-surgical procedures.
We're going to have you in again, and maybe we can bring someone that would be willing to talk about the treatment that they had, so it's a real life story. Thanks very much. We're going to take a break and be back.